Yes. Well, first, I hear what you're saying, and I agree with you about capitalism and the private sector. But instead of talking about the solution, I have a question about the problem. I mean, how did we get to this place with 47 million uninsured? And I would like to hear you, offer some critique of the insurance companies.
Well,
My
first,
husband is a medical professional.
part of the problem, Anna, is you have absorbed fraudulent information. What do you mean there's 47 million people without health insurance? Where did that come from?
Okay, so let's not...
No. We're going to take our time, Anna. We're going to take our time, and we're going to walk through this together. Where did that figure come from?
Well, it's what I've read in a lot of the media on the site of the
where does that
Medical
figure
Association.
Where does that figure 47 million come from? Either you know or you don't. Can you tell me?
Well, I've read it on the American Medical Association website.
Really? Well, why don't you go look at the census where they took it from, like I did? And you know what you find about those 47 million uninsured, Anna?
What?
That about 18 million of them earn over $75,000 a year and choose not to purchase insurance. About another 10 to 12 million of them are uninsured for a period of 4 months. Almost 10 million are immigrants, most of whom are illegal immigrants. When you get down to it, there are about 12 million people, I calculated, and it's in the book, after analyzing the census figures, which is where that 47 million figure comes from. It's 46.6 million, actually. And in analyzing it, you can find 12 million long-term uninsured, people who we could handle, but instead we choose to destroy the entire healthcare system. Isn't that crazy, Anna?
Well, but okay, so let's...
No, it's not. On to the next point. Right, Anna? Right in one ear, right out the other. I've just dispelled your false information, and you want to run to the next point. Okay, Anna, what's the next point?
Okay, it's not the next point. I'm asking you to help me understand it. I'm not trying to argue.
What do you want to understand?
So let's say, well, because I think insurance companies, my husband's a medical professional, they do...
What does that mean? What is it?
They do deny people with pre-existing conditions.
Sometimes they do. Now, if they accept, excuse me, ma'am, if they accept everybody with a pre-existing, let's say I'm 68 years old, okay? And let me do it, 58 years old, and I decide I want insurance because, as it turns out, I have heart disease and maybe I have 3 or 4 years to live. And I step in and I say, I want insurance. Now, are you saying every profit-making insurance company should take that patient?
What I'm saying is that the CDC...
No, I'm asking you a question. Is the answer yes or no?
Does every insurance company?
Well, ma'am, you're saying they turn down pre-existing conditions.
Correct.
You know, there's a lot of people who purchase insurance at a relatively young age without pre-existing conditions, and basically it's a private contract between an individual and a corporation. And the contract with the corporation is, look, I'm going to pay all these premiums year after year after year. Most of the time I won't need most of this, but I'm going to pay it so when I really do need it, I have insurance. Meanwhile, a guy walks in the door, he's 58 years old, and he says, you know what? I haven't paid a damn cent in insurance my entire life. I have heart disease. I need a bypass operation. Now I want insurance. Now, who do you think pays for that?
People that get laid off from their jobs.
And I'm going to ask you again.
Benefits,
really? Have you ever heard of Medicaid? Excuse me, ma'am. Do you want to be educated or ignorant?
Well,
if somebody is unemployed and they have almost no assets and no income, which is the example you're giving to me, we are spending hundreds and hundreds of billions of dollars on those people. Did you know that, Anna?
Well, all I know is that the CDC...
Oh, no, wait a second. You don't know enough. Do you know what Medicaid is, Anna?
Yes.
Well, what is it?
Medicaid is an insurance program for those below the poverty line.
Oh, really? Oh, that's interesting. And do you know 1 out of every $5 every state spends goes into Medicaid? Did you know that?
Well, gee, maybe if people had insurance...
Well, gee.
We wouldn't have to be...
Well, maybe if people would purchase insurance when they're not... You know what? You're an idiot. Get out of here. You're just an idiot. Poor Anna. Poor Anna. Our system sucks so bad. Now, I'll tell you a little secret. It's not even people below the poverty level. It depends on the state. Some states say people who are 200% above the poverty level. One state says 400% above the poverty level. They don't care who's paying for it. They don't care where the taxes come from. And yet Medicaid is still going broke. And if Anna would ever shut up and listen for a minute, but she's reflective of what we're dealing with, my question was going to be, well, all these entitlements for people who aren't paying in the amount that they're taking out are trillions of dollars in debt, Anna. Now, what do you want to do about that as a good socialist? They have no answer whatsoever. None. None. Now, let's go back to Milton Friedman. Anna acts like government's not involved in health care or regulating insurance companies. Do you know insurance companies are regulated up the wazoo? I don't care for them. That's not the point. State insurance agencies regulate them to the point where a lot of your premiums are so expensive because you're covering mandates that have been put into these insurance policies at the direction of politicians in your state legislature and your governor. That's why they're not portable from one state to another, because they have to cover different things. So maybe they'll cover breast implants. Maybe they'll cover something else, absurd stuff. And some of it is very absurd and expensive. And you're paying for that. And that's part of the problem. And that's why a lot of us are arguing to get rid of a lot of that and have portability, where insurance companies can offer bare bones plans for catastrophic cases, or different levels, like when you buy a warranty on your car, if you do. You can have silver, gold, platinum systems. Well, why can't we do that? Why can't we have much bigger deductibles and have most of our policy funds go toward a potential catastrophe or catastrophic health care? Why can't we do that? Because the states and the feds won't allow it. Won't allow it. So competition, which we have when it comes to the sale of washing machines, we have much less of it when it comes to the sale of insurance policies. And I explained this in Liberty and Tyranny. We have these outrageous policies that impose outrageous conditions on the private sector. And then when the policies are expensive, or forget about policies, if a product is so expensive, or if it doesn't cover what you think it should cover, what does the statist do? Attacks the very industry that they're destroying. The private insurance market is already in critical condition because of what's being done to it. Look at my premiums, they're so high. Have you ever asked why? Who sets immigration policy in this country where you have to subsidize illegals who get coverage for free? Who's allowing the lawyers to run free without tort reform? Who? Excuse me, whom? Who is it that puts all these mandates in place for ridiculous procedures that you and I have to pay for? Whom? Think about it. Think about it. You strip some of this away. Not only would it be morally proper, it would be cheaper. Just remember what Milton Friedman was saying. Government spending, and by the way, government regulation does not produce wealth unless it's regulation that's intended to produce wealth. That is, promote commerce and trade as the Constitution compels. That's what the Commerce Clause is there for. That's why it was put there, not to prevent commerce and trade, not to regulate it out of existence, but to promote it as a national priority. It's an enumerated power that's been turned on its head. Anyway, I'm willing to take the unpopular position of arguing about insurance companies. And by the way, that's not to say they're perfect. I don't make that claim about anything. And that's not to say they don't do stupid things. I know they're imperfect and they do stupid things because guess what? An insurance company is a collection of human beings like every other entity. But the difference is, when one insurance company screws up, there are others. But when the federal government screws up, there are not others.